My name is Romano Richard Capena, and today we are going to talk about factors affecting wound healing. Okay, what is wound? When we talk about wound, for example, this is an epithelial lining. Okay, this is the skin. Okay, so discontinuity of the skin epithelium, and there is a discontinuity that we term as wound. There are different kind of wound, different factors, different causes of wound. Okay, different things that cause the break of the epithelial lining of the wound, but we are going to discuss all of that, but mainly I'm going to deal about factors affecting wound healing, favoring or affecting whatever. Okay, now wound healing is a mechanism whereby the body attempts to restore the integrity of the injury. The body provides, if it is fibrosis, due to fibrosis, the blood, the deep things, they will line up here so that they bring back the continuity, they fix this, that the break of the continuity of the integrity of the injured part. That is what we call wound healing. There are different. There are 4 stages of wound healing, which we'll discuss as we go in front. So, what are the factors that affect wound healing? There is infectious causes, nutritional causes, medication causes, drinking alcohol, diabetes, and ages. But before that, let's just mention the factor, then I'll discuss each factor. Site of wound. Okay, it depends on the site of wound. If the site of wound is in the open place or place which it mainly land with water. Okay, structure of wound, the wound structure, mechanism of wound, if the wound causes incised or avulsion, contamination, loss of tissue. Now let's discuss each factor. Okay, let's forget about the systemic factor like malnutrition, local factor like vascular inefficiency. Now let's discuss each factor. Let's start with the infection factor. For example, there is clean wound and contaminated wound. If this wound here, it is contaminated with infectious material, bacteria and what, it will be very hard for the wound. It will take long time for the wound to heal. Okay, that's one of the factors that affects the healing of the wound. Nutritional factor, that are the systemic factor. If one is not having healthy nutrition, healthy diet, so that patient will have difficulty in wound healing because the factors, the synthetic things, like you say, the fibrosis, they will be not there available. Let it be available for the body to heal the wound, to deposit on the wound, and to bring about the normal integrity of the surface. Okay, medication, different medication, like you can say steroid medication. They limit the healing process, that the wound will take a long time to heal due to the different kind of medication, especially the steroid or non-inflammatory steroid, NSAIDs. Okay, age. A young, like a toddler, 10 to 11 years old, 0 to 11 years, they heal fast, okay, compared to older people. Older people, like you say, 60, 40, 45 years old and above, they take a long time for the wound to heal compared to the young, the toddlers, children, and adults. Diabetes. The patients with diabetes, they are very, if they get injured, they take a long time, since diabetes does not favor wound healing. Okay, there is a extended this, but it will take a long time. But diabetes is the main thing that limits wound healing, and people with diabetes, they are supposed to take care of their wounds, since the progress of the wound in a diabetic patient, the prognosis is bad compared to non-diabetics. Alcohol is also among the factors that they affect wound healing process, that the wound will take a long time to heal. Now, what are the factors that, for example, what are the factors that they influence healing of the wound, site of the wound? If the wound is, for example, in the open part of the body, the arm, okay, it will heal faster compared to the part that is closed due to the warmth, the body, and what. Structure of the wound. An incised wound, as a small structure, it heals readily compared to the brush wound, like we call untidy wound. Okay, uncontaminated wound will heal fast compared to that. Okay, other factors could hypoxia. Okay, vascular insufficient. If the blood flows to the part, okay, that part will have a good prognosis. The wound will heal fast compared to the part that has insufficient flow of blood. These are the factors that they mainly affect wound healing. But if we talk about wound healing, we can talk about phases of wound healing. There are, as I told you, wound healing has a lot of phases, but we are talking about, there are mainly 4 phases. So there is really 3. There is inflammatory phase that mostly take place after the hemostatic phase of the wound. Then there is proliferative phase, where proliferation takes place, that fibroblast and everything begins. Then there's remodeling phase where the skin starts remodeling, sutures itself, and the integrity is normally restored. Those are the phases of the wound. If we classify the wound closure, there is mainly, just to mention, there is primary intention, mainly occurs at the minimal scar. It's mainly at the wound which it's lately and it's clean and the edges are opposed. Then there is secondary intention, that the wound heals by agglomeration and contraction. The wound are not opposed compared to the primary. And the tertiary is when the wound will heal when there is favorable condition, but the wound is open and they are prone to infection and everything. Types of wound. As I said before, we compared the wounds. I mentioned the tidy wound, but types of wound you can classify in tidy and untidy. Tidy, you can say incised wound, that for example you get it on an operation. Then there is untidy wound. Untidy wound are those caused by crushed, avulsion, contamination, devitalized. Untidy wounds, they are bad wounds even to watch, but the tidy wounds, they are clean, small cut and everything, like you can see in the picture there. The right side of the wound is tidy, it's clean, it's incised, like it's mainly a sharp or a laser has passed there. But if you see in the next picture, untidy wound, it's avulsed, like there is contusion and everything. Then there is acute wound compared to the duration of the wound, the acute wound and chronic wounds. And this all are, in a nutshell, everything concerning wounds. But basically, I was mainly talking about the factors affecting wound healing. Hope everybody understood everything. Thank you for your time.